Hi, my name is Jennie Mercer, and I'm the Director of Strategic Initiatives for PAM Health Specialty Hospital of Reno. Who here has heard of PAM Health or Long-Term Acute Care Hospital? Oh, PAM. PAM. It's called PAM. It stands for Post-Acute Medical. Well, I'm here to talk about the different levels of care, not primarily our hospital. I'll go into detail about what our services are, but primarily to talk about the continuum of care. So the role of continuum health care in the hospital setting, as well as skilled nursing and acute rehab. So, for example, who here has been hospitalized? Okay, and did you feel that you got appropriate direction as for discharge planning? Nope. So here are the different options. This is the slide I need. So this is the continuum of care. So for example, you go to the hospital and you have, say for example, a wound on your foot and you're not sure what it's about. So you go to the hospital, which is considered a short-term acute care hospital. There's different levels of care in the hospital setting. Short-term acute care hospital is considered Reno, St. Mary's, Northern Nevada, and average length of the stay when a patient goes to those short-term acute care hospitals are about 4 to 7 days. Then at that point, if you need surgery, if you need IV antibiotics, if you have a wound vac, you have wound care, whatever the case may be, then case management comes and talks to you in the hospital and says, okay, what's that next level of care look like for you? Whether you can go home, you can go to a different hospital, you can go to acute rehab, you can go to a skilled nursing. There's just all these different varieties of discharge planning that you can go to. So this is very busy, and I understand that, but I do have a flyer up front that kind of talks a little more into detail about what the different levels of care. So short-term acute care hospital, 4 days. So for example, you came in with, say, infection to the bone, you've got a wound vac now, and now you need IV antibiotics. Now where you go from here? You can go home with home health, and we've got a vendor here that can talk about that. You can go home with IV antibiotics, you can go to the hospital and get your IV infusion done, or you can go to long-term acute care hospital, which is my company, PAM Health. Long-term acute care hospital patients do have to meet clinical criteria in order for them to come to our hospital. So we do see more medically complex patients, whether it's wound care, IV antibiotics, we provide therapy, as well as patients that are really, really sick, who are on a ventilator and has a trach and he has a breathing machine, and our ultimate goal is to get them off the ventilator. I would say about 50 or 55% of our patients do go home. That's our ultimate goal, is for them to be discharged home, but if they need that extra level of care, whether it's to continue on the IV antibiotics, they need more therapy services, or they still have that wound vac, then that next level could be a skilled nursing facility, which is right there on the right-hand side, where patients can go to a skilled nursing facility to get that extra bump and that extra level of care that they need, and then ultimately, hopefully, go home at that point. There's also acute rehab. Acute rehab, there's 2 in the community, renowned in Northern Nevada, where they have to be able to participate in therapy for 3 hours a day. So they have to meet clinical criteria as well to go into acute rehab, but we only have the 2 that are local here in Northern Nevada. Or obviously home with home health. I mean, that's the best place I feel like to be, to heal is at home, and we've got services here in this seminar to discuss the different levels of home care. So for PAM Health Specialty Hospital of Reno, we take more medically complex patients. Here's our top admitting diagnosis. We do see a lot of patients that are on respiratory, so high flow, on the ventilator, on a breathing machine, sedated, and needs to come over for ventilator weaning. But we also see other diagnoses, just the small stuff. IV antibiotics, wound care, diabetic management, and those sorts of diagnoses. Our specialty treatment over at PAM Health is pulmonary, wound care, and medically complex patients. We are a hospital inside Northern Nevada Medical Center on the 2nd floor. We're a 24-bed hospital, and we bill Medicare Part A as an Apple for their insurance coverage, as well as we're in network with all the commercial insurances as well as Medicare Advantage patients. Again, why PAM Health? Again, we've got physicians that round at our hospital. Daily, we have on-site dialysis, we have 24-hour nursing care, CNAs, as well as respiratory therapists. We also provide physical therapy, PT, OT, and ST, and all of our nurses are ACLS certified. And that's kind of a nutshell of the hospital. I do have a couple brochures up front, a little bit about Medicare. It's 2025, Medicare Part A covers for hospital, Medicare Part B covers for physician, and then there's obviously the prescription plan, which is the Medicare Part D. So I have this information for you as well.
So are you an employee of the hospital?
We are not employees, so we rent and lease space from St. Mary's. We're a hospital within the hospital, so we're our own company and we have our own staff. But we utilize their ancillaries, so housekeeping, lab draws, radiology, and whatnot.
So upon discharge, who makes all the suggestions?
Case management.
Case management.
Yep, so every
So
time
it's
you
a
go
nurse
to
in
a
the
hospital, any hospital that you guys go to should be, a case manager or a social worker should be reaching out to you to discuss the different levels of care or what resources and what you need
Before
upon
discharge?
discharge. Upon discharge.
Wait, I know you went too fast. and
Yeah,
a lot
sorry.
of- A lot of the people without medical background would not understand you.
Okay,
After
yeah,
you
no,
landed?
sorry, I
Yeah.
went so fast.
Do you have this facility at Northern Nevada in Sparks?
We used to be inside Northern Nevada in Sparks, on the 6th floor. We were there for about 4 years and we moved inside St. Mary's last year. Yes,
Sure, so you said you have 24 beds.
correct.
What happens when those beds are full?
So average length of stay when a patient comes to us is about 25 days. So when patients hear long-term acute care hospital, they feel, oh my gosh, am I gonna live there? And how long am I gonna be there for? Average length of stay per Medicare guidelines is 25 days. So we discharge patients and then fill the beds.
All right, what happens if they're not ready to be discharged?
If they're not ready to be discharged, then they stay there until they're medically stable to be
And then what happens
discharged.
if all 25 beds are taken? Where does someone go?
They can go to a skilled nursing facility.
So they can't go to your facility, they'd have to go to someplace else?
They can go to someplace else. They can go to a skilled nursing facility as well as acute rehab if they meet qualifications.
Thank you.
You're welcome.